My name is Emily Ulen, and today I'm going to be discussing an interdisciplinary collaboration experience from my current workplace and elaborating on what went well and what did not. First, I will discuss how poor collaboration can result in inefficient management of human and financial resources supported by evidence from the literature. I will also identify best practice interdisciplinary collaboration strategies to help a team achieve its goals and work more effectively. Lastly, I will include best practice leadership strategies from the literature to again help a team achieve its goals. It has also been asked that I relate my personal experiences with interdisciplinary collaboration to a scenario in the Villa Health team. With supporting evidence from the literature, I will suggest recommendations on how the team could work together more effectively. For some background, I'm an emergency department nurse at a level 1 trauma center in the inner city of Columbus, Ohio. We deal with the worst of the worst, so maintaining a strong team is something we try to pride ourselves in. Although we are great at what we do, we have many areas for improvement as a team. Recently, due to the surge of COVID-19 and a critical shortage of staff, operations in our department have changed drastically. In response to the current climate, Ohio Health has decided to trial what they call crisis bedding in an attempt to combat the surge of patients we are seeing in our department. Not only has our department faced a surge of patients due to COVID, we have seen record numbers of gunshot wounds coming through our doors. Today I will speak on how recent policy change was successful and unsuccessful. I will cite evidence from the literature that will help support my recommendations on what could have been done differently. Part of the crisis bedding initiative is to room every single patient that walks through our doors immediately, avoiding creating a lobby of patients waiting to be seen at all costs. If the room is available, the patient will be placed there, regardless of how much nursing staff is available. This results in nurses having to take assignments of 5 to 6 patients in the emergency department, regardless of their acuity. Those numbers are much higher than the recommended ratios for emergency department nurses. This has resulted in a lot of the nurses leaving the department to seek employment elsewhere due to the amount of stress posed upon us. In order to fill staffing gaps, my department has hired a large number of travel nurses, which costs almost 3 times the amount to employ as it does a regular staff RN. Adams from the Institute of Medicine recommends that healthcare facilities avoid employing nurses working from temporary external agencies because this causes risks to safety. Although having the extra staff helps fill in gaps for staffing, it poses a risk to safety, and due to short-term contracts, they are unable to provide care to our many trauma patients because of the complexity and training required to care for these kinds of patients. Many staff members feel that when making a decision to change the way our department operates, we should be included in the process of that change. In a debate about organizational change theory, author Roger speaks on an interdisciplinary collaboration theory known as diffusion theory. In this theory, it is explained that organizations go through 5 stages as part of the diffusion of the innovation process. The initiation and implementation phases are separated by the decision to adopt or not to adopt. An adopted innovation proceeds through the 3 stages in the implementation phase. Ohio Health's crisis bedding initiative was not discussed with staff members that the policy would be affecting before it was implemented. Administration sent out an email on a Friday evening that basically laid out our new reality with just a 72-hour notice before the policy would take effect. This caused a lot of outrage among the staff because increasing our ratios during a pandemic seems unsafe and unreasonable to many employees. A lot of us also felt disrespected in the fact that this was not even remotely discussed with staff before it was decided to be implemented. This is not a good way to build trust with staff, and we have seen a definite decrease in morale since this policy was abruptly sprung upon us. When implementing change and collaborating among team members, it is of utmost importance that best practice leadership strategies are used to help a team achieve its goals. Leadership strategies I found in the literature include participative leadership, which is to involve team members in the decision-making process. Team members thus feel included, engaged, and motivated to contribute. The leader will normally have the last word in the decision-making processes. However, if there are disagreements, a consensus between the team members can be made. This sudden change in the nurse-to-patient ratios could have been handled a little better if a leadership strategy style like this one I just explained was used. The policy change has decreased staff morale and increased burnout rates. Using a strategy similar to participative leadership may have helped decrease some of those negative impacts. The scenario in the Villa Health activity displayed what can happen when the interdisciplinary team does not collaborate effectively and the negative implication for the human and financial resources it can cause. Although the corporate team members running Villa Health were trying to make a good financial decision by choosing a company they knew they could get a deal with, they did not consider all the issues they may run into using a cheaper company. Staff has expressed many concerns with technical issues with the new EHR system and feel like their concerns are not being heard. They hired a cheap coach that staff felt has not done anything to help make the implementation of this new system any easier. On a human resource level, this has created stress among staff and decreased job satisfaction. Due to the amount of technical issues, nursing staff feels they are spending less time taking care of patients and more time trying to troubleshoot computer issues. IT staff feels like they feel lost and like they did not get the proper training due to the ineffective coach that the company hired. Overall, it seems that the decision to go with HealthX to save money has created more issues than solved. In literature I found regarding transformational leadership has explained as the leader inspires his or her followers with a vision and then encourages and empowers them to achieve it. Excuse me. The leader also serves as a role model for the vision. This strategy used motivation and inspiration to gain the support of employees and will even help lower employee turnover rate. It is not a coercive approach to leadership and will place high value on relationships among staff. I believe hiring an outside coach to help staff implement this new change was a poor decision on Villa Health. Elise Wang, the director of operations, is already a well-known resource to the company and even goes on to explain that she knows the staff better than anybody. She knows who will respond to what and values the collaboration process that has already been established within the company. Due to the stress of the new change, staff have stopped communicating effectively and collaborating in a way that is beneficial to the group as a whole. In literature about organizational change theory and interdisciplinary collaboration strategies, author Kurt Lewin wrote about group dynamics, noting that individuals are influenced by group norms and pressures to conform such that group behavior should be the target for change. This is because group decision-making is powerful with respect to bringing about lasting behavioral change among group members. With the new difficulties presented by the new system change, nursing staff have stopped collaborating and working together due to their own personal feelings regarding the change. The IT managers have refused to continue working with the coach the company hired to implement this change, which in turn has created issues for corporate because team members are no longer wanting to work together. Focusing on this group's dynamics as a team is something that I believe would be beneficial if looked at more closely. Interdisciplinary collaboration can sometimes be difficult depending on the circumstances. However, I believe that if best practice strategies are used and the proper time is dedicated to implementing changes with staff input, collaboration amongst all staff can be greatly improved. In regards to the literature and sources that I mentioned, all information was found using credible sources, including scholarly articles and journals. I have attached a reference list along with this video. Thank you.